Hey, this is Dr. Brian Robbins and Dr. Isaac Hill from CorMedix Medical Center, and we are here today to discuss one of the cases that we've seen in this past week or two here, and we've had some pretty phenomenal success with. So we're going to jump right in, and I'm going to ask Dr. Hill to tell us a little bit about this case.
Sure. So this was a gentleman that came in and he started complaining. Chief complaint was numbness in the fingers. And so as we kind of got a little bit more digging into his case and his history, realized that he's been dealing with neuropathy in the feet, and his feet were actually way worse than his fingers. And so we ended up doing an exam on him, and his feet were about this one of the worst cases I've seen, about 90 to 93% loss of sensation in the feet, and he was about 45 to 50% loss of sensation in his fingers.
Can you,
Sure.
for those out there that don't know what that neuropathy is, a huge word. Can you tell a little bit about what that actually is?
Absolutely. Neuropathy, when you just break it down, it is literally your nerves are dying. And that's just the simple, raw form of what neuropathy is.
Okay.
And so when you're dealing with a neuropathy or nerve that is dying, you got to stop that progression as quick as possible, or else it leads to complete death. When it leads to complete death, we're dealing with an amputation. We're dealing with toes lost, feet lost, legs lost. So it becomes a very scary situation. And so this particular patient, we started him on our program for neuropathy about 3 weeks ago. And 3 weeks ago, we're dealing with changing him in dietary. We're dealing with some at-home treatment that we'll talk about in a second. But want to really emphasize is that he came in this week and he said, "Doc, I'm getting a little excited." And I said, "Okay, great. What are you excited about?" And he said, "I feel like I got my feeling back in my fingers, about 95 to 99% feeling back in my fingers."
Now, let me get this right. So he's been under treatment for how long?
Just 3 weeks.
3 weeks. And
Just
do you
3
know
weeks.
do you know how long before he came in for treatment? How long he's had these symptoms? Do you know that?
Yeah, he's been dealing with neuropathy, especially in the feet. He's been dealing with it for about 5 years.
About 5 years. And so in 3 weeks, you've already seen significant changes.
Absolutely.
Awesome.
And so really exciting. He still said that I'm still not feeling it in the feet. When you're dealing with a case of 90% or greater loss of sensation, we really emphasize that it's going to take a long time. So this didn't happen overnight. It's not going to go away overnight.
Right.
And to just give it about a year to 18 months is where he needs to really focus his time and energy and understand that there is the hope in the horizon. So yeah, when we're dealing with these kind of cases, it can be heart-wrenching a little bit to kind of see people who have lost hope. So it's really nice to see when we can give a gift of hope back to them.
Yeah, I was reading a little bit because I knew this was the case you were going to present today, and I saw that something like 18 to 22 million Americans suffer from neuropathy.
Yeah, it's sad.
And I think I read that the best drugs have about a 50% success rate. What kind of success rate does the therapy that we're using here at CorMedix have?
Yeah, that's a great question. So when you're looking at what exactly is the program look like, you have to understand that you got to take the nerve kind of like a plant, and a plant, it needs sunlight and it needs nutrition and it needs stimulation to grow. And so our program, we use what's called an anodyne, and an anodyne is a red light stimulus. So it's bringing light to the nervous system and it's bringing growth to that nervous system. And then we also give a at-home nerve builder. So it's a stimulation to bring connection and pathway connection back to the brain. So when you're losing that pathway from brain to body, in this case feet or hands, we got to keep stimulating it. And then you also have to bring the right nutrition. You got to be able to maintain that integrity to that nervous system. So those three things is what we emphasize, and majority of it is done at home. And that's what's really powerful.
Okay, that's awesome. I think I read that the anodyne can increase blood flow like 2,500% to the extremities like that. Does that sound like
Yeah, the research out there is phenomenal, and the studies that are out there are showing an effectiveness is a 97% success rate. So it really blows anything out there that's out in the market today.
That's awesome. If there's folks at home that are just sitting there thinking about, they've got numbness and tingling, they're losing some sensation, maybe even losing balance because of they can't feel their feet so well. What does the process look like if they want to come in and just find out if they're even a candidate? How does that step by step happen?
Yeah, absolutely. So you call the front desk. Front desk will find out what kind of issues you're dealing with, and they'll get you right into what's called we do automation communication, and so we'll set you up for a personal video that'll kind of explain about what neuropathy is and then how we treat it here. And after that video, which is about 30 minutes, you can kind of, no obligation to you, you can do what's called an exploratory or discovery visit. And at discovery visit, we kind of take some x-rays, a scalp view, and we just kind of see how the spine is looking, and then we kind of get into some of the exam. And the exam is to see how bad the neuropathy is by doing some neurological testing on you. And then from there, we just do what's called an ROF, which is a report of findings on what we see as your case and what we'd recommend for your treatment. And we just go from there.
I've heard you say that not everybody's a candidate, that's one of the things you find out during the discovery visit. And if they're not a candidate, then you typically just refer them to another physician if need be.
Yeah, absolutely. Our goal is to get you where you need to go.
Awesome. Well, that you've learned a little bit about neuropathy. It's a very dangerous and very debilitating situation for many Americans. And if you're sitting back and having those symptoms and you'd like to get checked out and go through a discovery visit, just call CorMedix 793-0700, and we'll be glad to set you up with a discovery visit.